This is our patient, W, not William, can't tell you his real name. Anyway, we're going to go ahead and I'm going to show you how we're working on him. We're going to do a rather large procedure on him. It's got plan on anywhere from 34 to as much as 3,700 grafts. He's got a really, really nice donor supply, so I think we're going to be able to get at least 3,400 grafts. And the goal is going to be basically to fill in this entire area of thinning. Let me show you what we do to go ahead. And you're welcome to ask questions. I'm just W. It's not George Bush. W. Okay, I'm going to show how I like to mark out patients. It's got a nice teaching example. That was a good idea, Jackie. Okay, chin up for me. Okay. We had talked about doing a little bit of conservative lowering along the sides, and I'll go ahead and I'll mark that out for you. You're 37? Yeah, so we want to go reasonably conservative. All right. I like to first start out by marking the midpoint. And then coming around like that. And what I like on the profile is to have a slightly upsloped hairline. And we'll go ahead and check that. Okay, good. Chin up for me just like that. All right, we're off a little bit. And I don't have any hard and fast rules for how I do the hairline, but I like to just sort of, usually just things just sort of look good to me. And I'll let you know when I get to that point, and then I'll show you what I think. Better. Just a tad too low on this side. Chin up for me a little bit. There's some guys that use like stencils and things like that, and I just don't think it looks as natural. And we'll go ahead, or I think I can have more, just get a better result when I do it this way, more aesthetic result. Alright, the way that one looks, it's just a little. And with the line that you're going to see is actually going to, it's going to look like a solid line, but of course it's going to be very irregular. And I'll show you from that, once yeah, I like this, what we've done for you. Let me go ahead.
The little and big that you put
exactly,
in? Like the video?
Exactly. Go ahead and hold this one. Now, what I like to do is, by looking at the mirror, it also gives me a different perspective. It gives me your view, and I think overall we're pretty good. I have it slightly receded, but I really want to go ahead and fill in all through here, and go back to around here. Now, we have the ability to do a little bit of lowering. As you see, as you desire it. This area on the side, these hairs grow sort of like this. So I go ahead and I make this separate. These hairs are going to grow like that. These hairs are going to grow like that. Same thing on this side. Once again, these go down like that, and these are more like this. So I follow that natural transition. And as far as how far back we go, I don't want to compromise density. I want to really make sure we get this frontal area really taken care of. How does that look to you all together overall?
Yeah.
I mean, it looks totally natural to me, and I think that's the key thing. And we'll let you see it during the procedure. You have a very, very subtle natural widow's peak, so I'm going to go ahead and just restore that just a tad. And I like my widow's peak to be a little off to the side, so I'll play with that a little bit. Okay. Cool?
Yep.